Well, now to something that can affect your child's education. Youth eating disorders. Statistics show 1 in 7 men and 1 in 5 women experience an eating disorder by the age of 40. 6 News reporter Andrea Uribe has more on how parents can be more aware about this mental health issue.
Research indicates that the number of teens with eating disorders has at least doubled during the pandemic, and medical professionals want to give you advice on what to look out for as your kid heads back to school.
It's very unusual, for example, for a female in our society who's going through high school to never go on a diet. As sad as that reality is, it is very common. It's kind of culturally a piece of that. So we try and tease out just going on a diet doesn't necessarily indicate an eating disorder. Folks with anorexia tend to be super dieters. They're just really, really good at it. And there's an anxious component to it, like I can't eat that, or how many calories were in that.
There are multiple types of eating disorders that can be brought on through many different environmental factors, but there are a few common triggers.
The research really tells us that there seems to be a lot of a genetic component with that. We really see it running in families, but beyond that, we also have this world in which we live in, and I feel like everyone, social media gets blamed for everything, but social media really has increased the focus on appearance.
If you feel your child could be developing an eating disorder, there are a few steps to take to ensure their safety.
Initially, we start with let's make sure they're medically stable and have a follow-up with the pediatrician or family doctor. And then secondly, let's start talking with them a little bit about what's going on. Teenagers and kids don't always tell us all of the truth, so I have an awful lot of faith in mama gut and dad gut. So if your sense tells you something's not right, then maybe you seek out a little bit of support.
For 6 News, I'm Andrea Uribe.